guys. I know you guys have been waiting. It's been a long wait for these respiratory videos. So first I'm going to talk about asthma. Okay, we're going to talk about asthma first. And as I always say, you need to know your A&P. Okay, this is a respiratory disorder. And you need to know your A&P and how the respiratory system works normally. If you know how it works normally, then you're off to a good start. If you don't know how it works normally, then it's going to be very hard to learn and really observe the alterations and learn how it's not supposed to work. Okay, so your A&P, and just to get the gist of it, you have your upper respiratory tract, you have your lower respiratory tract, right? You have your upper respiratory tract that consists of your nasal pharynx, okay, your oral pharynx, laryngopharynx, epiglottis, larynx, and even your trachea, okay? And then you get into the lower respiratory tract, and this has your left and right bronchus and your bronchioles, okay? Your bronchi are divided into the left and the right, okay, into the lungs, and they're made up of your smooth muscle and elastic fibers, okay? So in patients who have asthma, the physiological changes that occur are due to inflammation, all right? Due to the inflammation, it constricts the airway. The airway, it makes it smaller, okay? So that's the first step, all right? So your pathophysiology behind asthma is airway inflammation that leads to a bronchospasm and bronchoconstriction, okay? That's what asthma is, all right? It is highly linked to smoke, tobacco smoke in particular, okay? It's more prevalent in developed countries. And then there are different things that can trigger asthma, in which we're going to go through. So get it down. Your airway inflammation, okay? Inflammation is the swelling that causes or leads to a bronchospasm and bronchoconstriction, okay? The airway, it becomes obstructed due to the inflammation, and it reduces the diameter in the airway. So the airway is like this, okay? And as it starts to inflame, okay, the airway, you can breathe through here. But as it starts to inflame, all of this gets big, making the airway probably this small, okay? So it's very hard to get air in and out of there, all right? So that's going to lead to, we're going to go into our manifestations, okay? So our manifestations of asthma is definitely going to be that wheeze that we're going to hear, more prominent on exhalation, okay? You'll hear that wheeze a lot more when they're exhaling, okay? You're going to hear that wheeze on the exhalation. They will have a cough. And it could either be a productive cough with mucus and phlegm or a dry cough, okay? They will also have chest tightness and dyspnea. A lot of the disorders that you're going to see, if I'm talking about respiratory, are all going to have some sort of dyspnea, some struggle, some difficulty with breathing, okay? Definitely with your patients that have asthma or that are diagnosed with asthma, you for sure want to get a history. Okay, were they smokers? Were they ever smokers? Are they around cigarette smoke? Okay, you want to get a full history. You want to get a full physical exam. Okay, pulmonary function tests are some tests that you're going to want to get for your patients with asthma, and even some lab values. Okay, we'll go over lab values in a little bit, and your ABGs and all of that. We'll go over those shortly. Okay, you definitely want a pulse ox, because your pulse ox is going to tell if the asthma attack was severe or not, and you're going to monitor for any deterioration. Okay, they may come in satting, if they're having like an exacerbation of their asthma, they're going to come in satting kind of low, okay, but you're going to put that continuous pulse ox on their finger to see, okay, see how they're doing. Is it going to go up? If you give them oxygen, it should go up. Okay, from if they're at a 92, you give them oxygen, it should go back up to about a 97, 98. But if it does not, then you need to reassess and do some more interventions and then evaluate again. Okay, you definitely want to include for your lab values along with ABGs, in which I'll probably make a separate video for ABGs. Okay, but your lab values should include a urea and electrolyte panel to test the kidney function. Okay, Kidney function indicators in cases where your clients require a high dose or a repeat dose of certain asthma medications is key. Okay. Some side effects to this medication, these asthma medications as well, can be hypokalemia. Okay, and the medications that treat asthma also will get the heart racing. So we want an EKG as well. It's going to make them tachycardic. So we need an EKG to make sure their heart is doing okay. Okay, a chest X-ray may also be ordered to see if there's the exacerbation of the asthma was triggered by some sort of bacteria infection or any foreign bodies. So an X-ray will also be ordered. Okay, and then if they need an even better picture, then they're going to order a CT. Okay. What else? Your patients, so you also want to evaluate your patient's anxiety and stress levels, because stress and depression, they can also play a part in asthma and exacerbate the asthma. Okay. It plays a large part. If somebody is already anxious and they're more prone to getting panic attacks and they're stressed out, okay, it affects their breathing and it affects how they breathe. So if they already have asthma, it's going to exacerbate it or make it a lot worse. Okay. Some other things, just a quick recap of asthma is narrowing of the airway. Okay, that bronchoconstriction, it means narrow. Okay. Constriction. So your bronchioles or your bronchi are open usually. Okay, if somebody has asthma, it's not going to be as open. It's probably going to be like here. But then if they have that inflammation, it's going to make this airway even smaller, and that's why you hear that wheeze. Okay. You also want to assess like if they're fatigued, and if they've been working out, that can also trigger some asthma. Okay. Next, I want to talk about your role as the nurse. Definitely, I already mentioned the anxiety and assessing the anxiety and helping your patients cope, but also allergies. Be mindful that a lot of allergies can trigger asthma, can trigger an asthma attack as well. So you want to be mindful where your patient lives, where they come from, because patients in lower socioeconomic households and areas find it a lot more difficult to manage their asthma. This asthma medication is not cheap. Okay, it's not cheap. They're also living in poorer areas to where they have higher exposures to environmental triggers. Okay, asbestos and all of that. They live in environments where they're more prone to being around environmental triggers. So you want to keep that in mind as well. Okay, there is status asthmaticus as well. I will touch on that a little bit, and that is pretty much just the rapid onset of the severe asthma. Okay, it can lead to respiratory failure and even death if it's not treated right away. Okay, but that's the rapid onset of severe asthma episode. Okay. They will have hypoxemia, hypercarbia, and secondary respiratory failure, in which I will make a separate video on respiratory failure. Okay. But definitely you want to listen for those adventitious breath sounds. Adventitious means abnormal. Okay, this can give you your first sign of indication that it's either worsening or there's some complications. So listen for that wheezing. Okay. Other than that, keep your O2, if they're on oxygen, keep their O2 sats above 90%. Okay, keep it above 90%. We don't want them going hypoxic on us, right? And overall, that's pretty much it. Just be mindful of the key things that I pointed out. Think about, always have your patient's quality of life in mind, stress, depression, anxiety, how they're managing those things, and then your manifestations. What does someone with asthma look like? Okay, and then what does someone with severe asthma or the status asthmaticus, what do they look like? If it starts to worsen, we already know there's going to be some dyspnea, some difficulty in struggling to breathe. But if it's still not treated, and if it's not treated fast enough, then it becomes life-threatening. Okay, it becomes life-threatening in a more severe episode of asthma. Okay, they'll have extreme moments of shortness of breath, extreme chest tightness, extreme confusion, and then because they're not getting enough oxygen, they may even be cyanotic. Okay, and definitely in this event, we want ABG levels. Okay, we want ABG levels because 9 times out of 10, our patient will then go into respiratory acidosis. Okay, if you want ABGs, again, I will make a different video, make a separate video for ABGs and explaining ABGs. Okay, other than that, happy studying. Okay, happy studying. You guys got this.